Canada's often looked at as a country with free healthcare, but is it actually free? Don't our tax dollars actually pay for some of that, or a lot of it? Joining us today from Calgary to discuss this in more detail is Nadeem Esmail. He is a senior fellow with the Fraser Institute and nonpartisan think tank. Nadeem, welcome to Bridge City News.
Thanks for having me on the show.
You bet. Now, you recently co-authored a study on the price of public health care insurance in Canada, and you say that Canadians often misunderstand the true cost of public health care. Who's actually paying for the health care?
It comes from taxpayers. It comes out of the tax coffers. All of the money we pay in taxes and income taxes, business taxes, profit taxes. There are some healthcare taxes in some provinces, fuel taxes. It goes into one giant coffer. And out of that coffer comes our healthcare expenditures, which works out to about $225 billion in 2023. So it's Canadians who pay for it, but I think the way we pay for it makes it difficult for Canadians to understand just how much they themselves are actually paying for their annual healthcare insurance.
So what are the actual annual costs per family that are coming out of our tax dollars?
When we look at an average family of four in Canada, they're earning about $176,000. They're paying just about $18,000 for their healthcare insurance. That drops down to about $5,600 for an unattached individual, and then a one-parent, one-child family is going to be about $5,400. So large sums of money, substantial, again, reflective of the fact that some families will be paying more taxes than other families, but none of those dollar amounts are small, and certainly they're not free.
So have costs actually gone up after the COVID-19 pandemic? What have you seen? What do some of the numbers look like?
If we look pre and post pandemic, what we find is that the healthcare expenditures have indeed risen from before the pandemic to after. Certainly during the pandemic, we had some interesting movements upwards and downwards, but from before to after, we are certainly higher than we were. And remember, this is in the developed world's most expensive universal access healthcare system. So not only are these dollar amounts high for a family, they're high internationally.
Now, your study also shows that healthcare costs have been rising steadily since 1997. In fact, the costs have increased, what, 240%?
They have. That's about 1.7 times as fast as the average family's income, which means healthcare is placing an increasing burden on the family income. Now, we talk a lot about housing. Healthcare costs have risen about 1.6 times as fast as housing. So while housing costs have outstripped family incomes, healthcare expenditures have outstripped housing.
I understand that the rate of these rising healthcare costs has declined, what, over the last 10 years? So perhaps that might be good news. Do we know why the rate has actually slowed down somewhat?
We've seen a reduction in the rate of growth in government expenditures on healthcare over the last decade, which has brought healthcare expenditures just slightly above the growth in family income. So we're still seeing a fairly consistent share of family income going to healthcare expenditures. But remember also now in 2023, we have the longest wait times ever recorded in Canada. So the healthcare system certainly hasn't improved. And we already have a lot of money in the system. So as much as we've seen some slowing of expenditure growth, that growth in expenditures is still keeping up with income growth, which means we're not making any headway for the average family. And it's not a great healthcare system in exchange for it.
Now let's talk about healthcare costs and where a lot of the money is being allocated. Is it towards maybe helping those who are battling cancer and some other serious diseases?
Certainly, and that's going to be a fairly typical allocation. Healthcare expenditures will be driven towards those services that are going to be saving life and less towards those services where we're improving life or where we are treating individuals for conditions proactively because of the shortages we have in the healthcare system. And we see it in waiting lists too. The wait time for cancer is down at 3 or 4 weeks. It's still far longer than it should be. It's longer than physicians consider reasonable. But that's nothing compared to the year-long waits we can see in orthopedic surgery and neurosurgery and medically necessary plastic surgeries. So the wait times, again, will reflect that same distribution. When we look at the data internationally, what we find is the Canadian healthcare system is not too bad at dragging people back from the brink of death. The problem is it treats them terribly, if not inhumanely, in the process of doing so, with these remarkable delays for access.
So then how does Canada really compare to other developed nations with the amount per capita that we actually spend on healthcare?
When we look at per capita expenditures adjusted for purchasing power parity, Canada ranks about seventh on an age adjusted basis internationally among peer nations that also have universal access healthcare systems. When we take those expenditures as a share of income, of share of GDP, Canada ranks first. So, whichever way you cut it, Canada is among the top spenders on universal access healthcare in the developed world.
So let's compare maybe ourselves to the United States or some of the other, maybe some of the European nations such as Germany, France, and England. Do we have more physicians than a lot of those nations, shorter wait times, more hospitals, or even more diagnostic machines and clinics? How do we really compare?
We are bottom ranking when it comes to those comparisons. Let's take the US off the table. That's a non universal healthcare system by design, and that's not what Canadians want. So let's compare Canada to other universal access nations in Western Europe, in Australia, Japan. When we look at that peer group, that's 30 nations in total, we find Canada ranks in the high 20s in terms of physicians per thousand population, hospital beds, MRI machines, CT scanners. That is some of the lowest ranking access in the developed world for a healthcare system that ranks at the very top of the health expenditure charts. When we get wait times, it turns out Canada has some of the longest waiting lists for access to medically necessary physician and hospital care in the developed world. On average in Canada now, well over 6 months for the average Canadian. Again, in the developed world's most expensive universal access healthcare system.
So you focused a bit on wait times. Do you think maybe Canadians are getting a little frustrated and are going south of the border to get their MRIs or maybe some treatments?
Certainly, we're seeing increasing frustration, I think, among the Canadian public. It's showing up in polling data, it's showing up in conversations, it's showing up at the political level as politicians are being more responsive to the issue and more reactive to the issue. There are some phenomenal private alternatives that are growing and expanding south of the border, as well as in Western Europe, through the Caribbean, through Southeast Asia. That market has been growing for many years. And we're seeing some private operators create some interesting opportunities here in Canada as well. We're seeing some in British Columbia, some in Alberta, some in Quebec. But governments, again, across Canada, and we just heard from the CMA, the Canadian Medical Association, on the subject as well, they really want to commit to this failing model and trap Canadians within it, which is going to mean Canadians will have to leave their jurisdiction for the healthcare they need because the public system is clearly unable to deliver it in a timely fashion.
You know, through your research and study as well, what do you think it is needed to really attract more physicians and more nurses to come to Canada and practice here?
I think certainly attracting more professionals is part of the answer. Training more professionals in Canada is also part of the answer. We know medical school training in Canada was pared back in the early 1990s and has been increasing recently. But how many Canadian students who are capable, highly trained, qualified with excellent grades and backgrounds are going to Europe to be trained as physicians, going to the Caribbean? There are schools there that are advertising in Canada, come and become a doctor here, and then you can practice not in Canada because re-entry into Canada, you're an international medical graduate again. We need to be training Canadians here at home as well as being an attractive destination for medical professionals. And at the same time, I think we need to make better use of the medical professionals we have. Let's not forget we have physicians in Canada who are seeking more operating time or who could do more operating time but can't access it in the public system. And we have unemployed, fully trained Canadian surgeons ready to practice in Canada who can't find a surgical appointment in this country because there is no operating time for them.
Or how about some physicians who are actually driving cab in certain cities because they can't get a position here in Canada as a doctor?
Indeed, in that protective system that keeps many out, there are standards that need to be maintained, I think, for the healthcare system as a whole. But certainly the pathways in seem to be unnecessarily restrictive for physicians who were doing the same work in another country but are unable to treat patients here. It may be as straightforward as saying if you can have a European or American certification, we'll recognize that in Canada. That certainly that mutual recognition would certainly be one path to speeding up the process to get more physicians into service here in this country.
We seem to be seeing a lot of European nations using a model that incorporates a mixture of both public and private healthcare, and the results seem to be somewhat better than we're seeing here in Canada.
Certainly, and we've heard the premier talk about this. Alberta is walking down some reform pathways. I think it's a cautious and tentative at this point. But if we look around the developed world at all of those other developed nations that have universal access healthcare systems, we find the top performing ones all have private competitive providers delivering universally accessible hospital and surgical services with activity-based funding, pay for the care they actually provide, not for existence the way we do here in Alberta. They have private parallel health insurance sectors for patients to seek care on their own terms with their own resources when they wish to do so. And they all have cost sharing or user fees for access to the system, a small fee when you access the doctor's office or the emergency room to encourage a more informed decision making on the part of patients about when and where it's best to access the healthcare system. But generally speaking, if we look at the path of health reform around the developed world, developed nations with universal access healthcare systems have been moving further and further away from the Canadian model and finding better value for money and better access for patients. It's well time we took that lesson as well.
So where do you see healthcare in Canada heading over the next decade?
I am hopeful. I think we've seen some very interesting reforms in Quebec. Certainly, Quebec is moving down the activity based funding path very aggressively now. They have a larger private sector than the other provinces. And Quebec has always been a bit curious in having shorter wait times than other provinces for slightly lower expenditures. So I think we're seeing a bit more of that come to fruition. We've had a lot of talk about healthcare reform in Alberta. I think there's some positive ideas being tossed around. I don't think the legislation is quite there yet. But certainly, if those ideas come to fruition, if we see the Premier move us towards activity based funding, a larger role for the private sector, which we may even be seeing now at the fringes here in Airdrie, I think we're going to see some promising things. But I'm hopeful, but I don't know that I'm optimistic because we still have the Canadian Medical Association coming out and saying, no, the Canadian policy construct has failed Canadian patients. It stuck taxpayers with a world-class bill for very poor access to services. We need to double down and recommit to this model, which is a bizarre position to take, but certainly the position they seem to have taken.
So how do you put the fears at rest of somebody who says, I don't believe in a two-tiered healthcare system? I want to make sure that it's just the public system, everybody's treated equally, everybody gets the same care. But then on the other hand, with private care, you take some out of the queue so the waiting lists are not as long. So how do you try and convince me, who says, you know what, I don't believe in a two-tiered healthcare system, that this is the way to go, private and public?
I think the reality is when we fall ill or are injured, the two-tier and the private-public distinctions no longer matter. All that matters is quality care in a time frame that provides comfort, peace of mind, and successful recovery. So let's not ask the question, what do we want philosophically? Let's ask the question, how do we deliver that to patients who are ill, who are injured, who need health care? Let's look at Australia. This is a healthcare system that has private providers competing to deliver publicly funded, universally accessible services. They have a vibrant private health insurance sector that actually is tax subsidized to encourage high income earners to go into the private system so that the public system can focus on complex patients and lower income patients. They have cost sharing. But what's the outcome? They spend less than Canada does. They have shorter waiting lists than we do. And they have some of the best outcomes from the healthcare process in the developed world. That same lesson can be told in Switzerland, in Japan, in the Netherlands, where they've reduced wait times meaningfully as they move further along with the private sector. The lesson is clear. This is not about abandoning some philosophical position. This is about better universal access to healthcare for every Canadian.
Nadeem Esmail is a senior fellow with the Fraser Institute. Thanks so much for joining us today from Calgary.
Thanks for having me on the show.